I think we're going to begin. Hopefully our participants are ready. We will be doing questions at the end, but I want to first introduce myself. My name is Crystal Straight. As I said, I'm the co-founder of ProtectUS. ProtectUS has a really simple mission. We're here to create spaces for people to fight for public health and against misinformation. We've been working with students from around the country and around California through Teens for Vaccines, who are here today, and Generation Up, to support their efforts to, quote, hashtag crush COVID. Today we have Kimia from Generation Up, Aaron and Ayan from Teens for Vaccines, and they're here to announce the Public Health Ambassador Program that we're supporting. We have Paula Velasquez, our illustrious president of the San Juan Unified School District. And then, of course, we have Dr. Richard Pan, who is a Sacramento senator. He's chair of the Health Committee. Most importantly for this conversation, though, he is a pediatrician who's dedicated his life to fight for public health, especially for youth. So here to start the press conference and provide context to why we are so worried for our youth right now and ensuring their right to an education safely and the Delta variant, I'll pass it over to Dr. Pan to kick us off.
Thank you, Crystal, and really appreciate all of you joining us here today. Hopefully we can all unify around the idea that we should keep our students, our youth, our children safe from COVID, especially as we are trying to assure that they get an education, assure that they are able to go about our community safely. However, with the Delta variant, we can see this more infectious variant is putting children higher at risk because it's more infectious. Unfortunately, a lot of the language and politics around public health measures to control Delta and COVID are not taking account of our youth and our students at school, right? The American Academy of Pediatrics has talked about how important it is for universal masking in school. We've talked about how important it is for the youth who are able to get vaccinated to get vaccinated. But even then, what we see is that we see politicians and adults actually turning these into fights as our youth are watching this and going, what is going on here? What about our own safety? What are the things, why are people not listening to us? And I think, so in that vein, I shouldn't be doing the talking. We want our youth ambassadors to do the talking. So, so I guess what I want to say is that we have a, hopefully everyone understands we have a serious situation going on with COVID. Let's be very clear. Children can get sick and children can even die of COVID. Yes, they're at less risk. Less is not zero. And we're also asking them to come together in schools and other places. That can be done safely, but only if we follow our public health measures. But we should also listen to our youth. So, for example, is our youth having a problem wearing a mask or not? Or does our youth want to get vaccinated? And we should listen to them and not just try to impose our own views or politics on our children. We should think about what should we do to keep them safe, and we should listen to what their concerns are and how they feel about this, what's going on around them and how we can keep them safe. So with that, I really, again, want to appreciate the youth that are here and launching this ambassador event. And I now want to turn it over to Kimia Adar with Gen Up. Thank you so very much.
Thank you, Dr. Pan. Hello, everyone. My name is Kimia Adar, and I'm a 17-year-old senior at University High School in Fresno, California. It is such a pleasure to be here today with all of you, and I'm very thankful to be gaining more insight and perspectives on what it means to be an active member of your respective community. I'm the National Co-Director of Innovation and Strategy for Generation Up, which is a completely student-led organization that emphasizes the necessity for educational equity. We have over 400 chapters in 20-plus states, and we are so fortunate to have garnered several chapter leaders and ambassadors across the nation who share the same passion for student voice like we do. We run many campaigns during the year, some that have included the statewide push for ethnic studies being a graduation requirement, increasing youth civic engagement by implementing the State Seal of Civic Engagement, highlighting the significance of mental health in campuses, and of course, the importance of bringing attention to public health crises. GenUp is fortunate enough to have partnerships with organizations such as California Association of Student Councils, California Student Board Members Association, California Teachers Association, Ed 100, and many more. And this has allowed us to create lasting connections with several legislative bodies. Through these correspondences, we have managed to create coalitions that focus on many policy slate packages. And through our work with legislators and politicians from across the state, we've been able to assist in the passing of several Senate and Assembly bills, including AB 130, SB 14, SB 21, and several others. Through teamwork pursuits, tireless hours of drafting testimonials to deliver in these committee meetings, and countless discussions with fellow peers, elected officials, and adult advisors, we have been able to maintain our central focus, which is to continue centering the advocacy of vital issues around youth voices. We at GenUp are incredibly humbled to have been able to adopt the Public Health Initiative, and working with our phenomenal partners such as Dr. Pan and his team, ProtectUS, and Teens for Vaccines has allowed us to contribute to the fight against misinformation and following public health guidelines to protect the greater population. We're here today to build off this work that Generation Up and others have done to announce our ProtectUS Student Health Ambassador program to support and encourage students to speak up and call on their school officials to keep them safe in the classroom. We've been able to hold town halls and realize that some schools are doing everything to keep students safe, while others are not. We've noticed anti-science adults showing up at school boards fighting against safety measures like masks and vaccines. And we know that we have to speak up now, before it's too late. And with that, I'm delighted to introduce Aaron Parsa, a San Jose native active youth leader who is the founder of Teens for Vaccines. Thank you.
Thank you, Camilla. Hi, my name is Aaron Parsa. I am 14 years old. I am a 9th grader, and I live in San Jose, California, and I am the founder of Teens for Vaccines, a youth collective of ambassadors across the U.S. in several states such as California, Texas, Tennessee, New York, New Jersey, Illinois, Connecticut, Massachusetts, Louisiana, Missouri, and more. We have been in the trenches helping teens and parents with trusted information on the life-saving power of vaccines. We fight disinformation. We are also big into legislative advocacy to increase vaccination rates, especially through school-based healthcare, and protecting our vaccine clinics and communities from extreme anti-vaxxers, pushing for deplatforming them as well. Right now, we are all trying to crush COVID, but teen voices are not being heard. The only way to increase teen vaccinations is to involve teens. Teens must be part of the conversation. And that is why we at Teens for Vaccines are incredibly thankful to ProtectUS for championing teen voices and rolling out the Public Health Students Ambassadors program. The Delta variant is raging across America and disinformation is rising. Masking is still not a top priority in schools, putting us teens and our younger siblings at grave risk. Schools need to be a safe learning environment for us. Students must have easy access to vaccines, and masking must be a top priority. We at Teens for Vaccines are really excited about the Public Health Student Ambassador program for empowering us teens to crush COVID. Our work as student health ambassadors is simple but effective. We will be going to school officials and making sure they commit to ensuring our safety. That means supporting masking, offering education on vaccines and vaccine clinics, sanitation, and other safety measures. We absolutely will not sit by as anti-vaccine extremists infect our schools and school board meetings and create environments which make it unsafe for us to be with our fellow students. Please allow me to introduce Ayan Moladina, our Texas ambassador, who is a champion of public health and as a proud Texan, has had to face the harsh realities of weighing his personal health against his ability to be on school campus.
Hi, yes, thank you. My name is Ayan Moladina, and I'm 12 years old, and I live here in Austin, Texas. Out here in Texas, Governor Greg Abbott has banned schools and school districts from imposing mask mandates. How is it that in this country, everything gets turned into a political matter? This is not about being a Democrat or a Republican. This is about being an American citizen. This is a matter of life and death. I have said it before, and I'll say it again. Masks save lives. Just a little piece of fabric can save the lives of our fellow Americans. People ask for proof. They ask for the data. Well, I've got data. A recent study published in healthaffairs.org, for example, compared the COVID-19 growth rate before and after mask mandates in 15 states and the District of Columbia. It found that mask mandates led to a slowdown in daily COVID-19 growth rates, which became more apparent over time. Another study looked at coronavirus deaths across 198 countries and found that those with cultural norms or government policies favoring mask wearing had lower death rates. I have an entire report here about why masks work, and I have all the sources cited, and I'm open to sharing those with the press because there are credible sources from high organizations and universities that show that masks work. Friends, why is my right to safety and education less valuable than if Greg Abbott wins or loses the 2020 election? Why am I the one sitting at home because others refuse to wear masks? The independent school districts need to have the right to impose mask and vaccine mandates. The local health officials need to have the authority to look at the data for their counties and communities, and based on that, give advice to the legislators. The lawmakers need to take that advice. This will help save lives. This ambassador rollout is historic because students need to be part of the conversation, that conversation being about their health. Students have the power to make change. I'm inspired by what ProtectUS and Generation Up are doing, and I'm proud to be a part of this amazing initiative. The work that all of the people here are doing is saving lives. And I know I talk about saving lives a lot, but in this terrible pandemic, we have already lost so much, and it's time to put it to an end. If you would like to help, just wear a mask and just get vaccinated, please. Thank you.
And next we'll hear from Paula Velasquez, as I said, a school board member, to give her perspective from her role as one of these school officials.
Thank you, Crystal, and thank you as well to our teens here today. I'm Paula Velasquez, president of the San Juan Unified School District, and I'm here speaking solely on my behalf. I want to thank these courageous students for organizing Gen Up, Teens for Vaccines, for stepping up and demanding that they are both safe and get the education that they deserve. In school districts across the country, elected leaders like me are balancing the health of our educators, our school staff, and our students, and making sure that our kids get a good education. We have a responsibility to keep our children safe and healthy. We must enforce the public health safety measures that are required here in the state of California. This includes vaccine verifications, enforcing mask mandates, providing vaccine clinics, and providing regular testing opportunities for COVID for both staff, students, and for our community. We cannot play politics with the health of our students and of our community. Our students are leading and demanding that we keep them safe, and I'm proud to stand with them. Thank you, Crystal, and thanks for everyone for being here.
Thank you, Paula. And Dr. Pan, I'll ask if you have any final remarks.
No, I too want to join school board member Paula Vasquez and thanking our youth for being here and speaking out, and also, again, strong support of the Youth Ambassador Program. I think, as was mentioned earlier, our youth, our students, should not be pawns on a political chessboard. They should actually have a say in their own health and their own safety. That's what this should really be about. We should be focusing on the health and safety of our youth, and we should listen to them when they are concerned about that safety. So let's come together as Americans. Stop politicizing, stop making our children simply the end products of our politics, and instead empower them to speak out, empower them to make decisions that affect their own health and safety and that of their fellow youth around them. Thank you.
Thank you, Dr. Pan. And with that, I do want to open it up. If folks, first, I'd ask if you have questions about our student ambassador public health program, if we could answer those questions first. And then I know some of you may have other topics you want to talk about, but first, if there's any questions for about the teen ambassador program, please raise your hand and we can answer.
I'm not sure how to raise my hand, but I do have a question. MG Perez with KPBS in San Diego. First of all, kids, awesome, awesome, awesome. My question is, there are 2 students from California and 1 from Texas. Where are your different chapters for teens for vaccines? Do you have any here in Southern California?
Yeah, so we do have chapters in Southern California. One of our ambassadors, Emma Fox, is actually in LA, and we hope to build more of a presence in Southern California in the years to come.
And I do know we do have one of our teen ambassadors who couldn't be on, who is actually in San Diego proper, that we'll connect with you afterwards if that's appropriate. And then RNG wanted to just mention, I know the question was specifically about San Diego, but the other states in which we have teens ambassadors in.
Yeah, so we have ambassadors in, as I mentioned before, California, Texas, Tennessee, New York, New Jersey, Illinois, Connecticut, Massachusetts, Louisiana, Missouri, and more. So we are right now we are countrywide, coast to coast, north and south, like 30 plus ambassadors across the country. So we are a diverse group, and that diversity is it's a big source of pride for us.
Great. Any other questions? Wonderful. Well, again, we want to at ProtectUS, our whole mission is to create spaces for people to fight for public health and against misinformation, and want to give compliments to everyone here for all the work you've done, that you have done in terms of working to crush COVID, but also acknowledging that there is a lot of work left. Even with the vaccine approvals that we have had, there is still policy at state and especially at local levels in which you can advocate, in which we need your voices to be heard. So I appreciate that. I do know we have probably one more question from Melanie at the LA Times.
Yes, thank you, Crystal. You kind of hit on the point a little bit with my next question, but the legislature currently has a proposal by one lawmaker talking about vaccine mandates to enter public places, or potentially in order to require them of employees. I wanted to ask Senator Pan just your thoughts. I know this is a bill that you've been sort of working on as well. And if there's anybody else who had thoughts about mandatory vaccines, I certainly would love to hear those as well.
So basically, we're exploring a variety of different approaches, but what we do know is I would say a wall, but we have sort of hit essentially kind of a wall in terms of getting people vaccinated here in the state, and especially with Delta being much more infectious, we know we need to get much higher vaccination rates in order to slow down the spread of this virus. Now, I should also point out, it's not just vaccines alone, it's vaccines and masking. All these go together. Each one has its role in trying to slow down Delta. But, we've seen even here in California, hospitalization rates go up, case rates go up, not as badly as other states. We're doing better than most other states, but I mean, this is happening across the country, right? And so I think we're looking at what are some different options that are there to help support our businesses, that help support our workers, because after all, businesses don't want to have to shut down because there's outbreaks, right? Employees want to be sure they're safe when they go to work. Customers want to be sure they're feeling safe. And if they don't, then you do see a downturn, right? We don't need a public health order to scare people away, right? And so we want our restaurants and gyms and other places. And so actually, and frankly, I think many of them would actually have expressed that they would appreciate some state direction in this matter. And unfortunately, back to what we started from here, we have overly politicized public health throughout this pandemic. And that has made it much more challenging for everyone, government, business, and others, schools, to be able to make decisions, even when presented with the evidence, because you have people who have, we talk about misinformation and basically over politicization. So I mean, the pediatrician in me, and I am an elected official, so some people say, well, gee, you're a politician too. But I mean, the pediatrician in me, and the public health thing, is like, the evidence on masking is clear. There's very low risk to masking. It's almost zero to wearing a mask. So how does that become like a face diaper and a taking away people's freedoms, et cetera, when it prevents outbreaks from happening? Right. So we've basically overly politicized. We turned public health into a political battlefield, and at the expense of the health and safety of our community. And I think people want help on that.
And again, we're always, I think, from our perspective, so appreciative of Dr. Pan and how many legislators are rising to the occasion to really explore, any and all options to continue to make our community safe and prevent death, which is something that we're worried about. Paula, or anyone else, RN or Ian, I know you're in Texas, so this doesn't affect you as much. You're in a far worse situation. Or Kimia, do you have any reaction to policies that would require people to show a vaccine verification before going into restaurants? Or
I did have one quick follow-up. Is there social media or a website for Teens for Vaccines and Gen Up?
Yep, I'll send it to you right now.
Excellent.
But Kimia, were you going to say something?
Oh, I was just going to kind of echo off of what Dr. Pan was saying. So as someone who's from a very traditionally conservative area, I can safely say that our hospitals are at full capacity once again for the third month in a row. And a lot of elected officials in our area are not doing enough to issue universal mask mandates or universal vaccination requirements. And it's affecting a lot of marginalized people in the area, especially a lot of people of color are getting the virus. And a lot of people in my area believe that if you're vaccinated, then you're completely off the hook. But that's really not the case. You're still eligible for transmitting the virus. And I think that there's so much misinformation that's being spread right now. And that's really what we're focusing on fighting.
And I'll just add, we are now in the middle of the third school year that has been compromised due to this pandemic. We're close to having a class that will have graduated soon without having not experienced a quote unquote regular school year. And even with all of the primary interventions in place, schools cannot do this alone. We need our entire community to step up because we don't operate in a vacuum. Our community interacts and engages in so many different ways. So it's an entire community effort. It's why we call it public health. You can't opt out of it. You can't choose to not participate. We all have to. We all do participate, whether we like it or not. And we have an obligation to keep our students and our families safe.
Thank you, Paula. Aaron, any other thought? Okay.
So I just echo off the points about misinformation, and that fighting misinformation and disinformation takes away so many resources from talking about vaccine access and equity, because many rural and undersourced teens do not have the ability to get vaccinated. And this is why Teens for Vaccines supports school-based healthcare, which for these teens is one of the only options to be able to get vaccinated. So, like parents working two jobs, they also can't they can't take their teens to a doctor's office. So school nurses and school-based healthcare, school-based health centers, They really need our support during this pandemic to make sure that the COVID vaccine can get to teens of undersourced and rural parents.
Thank you. Any final questions? All right, again, we want to just thank everyone for participating. Again, I echo so many community members out there. Thank you. Thank you, Dr. Pan, for your endless commitment to public health. Thank you, Paula, for what you do for your own school district, but being here and supporting our teens, and to all of teens at Kimia, Aaron, and Ayan. Like, again, you are so inspiring to continue fighting for your right to education and your right to life. So thank you so much for being here. And we are excited to continue this work with you and help people from all over. Thank you.